Osteoarthritis is the most common joint disease globally. It affects 21% of Australians over the age of 45. Imaging such as X-ray should be avoided for the diagnosis of osteoarthritis. This is because structural presentations such as loss of cartilage and bony changes do not always lead to the actual symptoms that we experience. A research paper reviewed 72 different articles on people who have osteoarthritis on imaging. The researchers found there is a lower number of people who actually presented with symptoms, even though they have structural damage on imaging. This informs us not everyone with osteoarthritis on imaging will experience symptoms. Imaging can actually do more harm than good. For instance, if someone provided us with an X-ray of our knee and showing things like bony changes and narrow joint space, this may actually increase our pain. This is because pain is 100% output of our brain, so how our brain perceives our joint quality will contribute to how much pain we'll experience. Knowing the extent of our joint damage through imaging has minimal to no implication on our treatment. Imaging such as X-ray can be expensive and induces radiation, and this can increase our risk of developing cancer and other side effects. We want to avoid weight increase. A research paper reviewed people who are overweight and with osteoarthritis. The researchers found for every 1 kilogram of weight loss, we get 4 kilograms of pressure off the knee. This is very significant when you consider that we take thousands of steps every single day, and this cumulative effect can have a significant impact on our life. It is important to be mindful that this study was done on people who are overweight. So for people who are underweight and with osteoarthritis, weight loss is not routinely recommended. We want to avoid having an injury. After ACL injury, our risk of developing knee osteoarthritis increases by 4 times, and an injury to the meniscus or meniscus and ACL increases our risk by 6 times. Another study looking at soccer players found more than 50% of the players developed knee osteoarthritis within 12 years after having an ACL injury. We can reduce our risk of injury by consulting a physiotherapist and having a detailed analysis of our gait, biomechanics, and alignment. If you participate in sport, your physiotherapist can also prescribe you with an injury reduction program, such as the FIFA 11+. One study found a structured warm-up program led to a 32% reduction in all injuries. If you find today's video to be helpful, don't forget to subscribe. Thank you for watching. We will see you next time.